Duet? Yeah, that's perfect. Yep. Good morning. Am I good to go, Mike? Okay. Mike is recording back there. Welcome to Transitions Program 2024. For those of you I don't know as well, I'm Lisa Martin. I'm Director of Resident Life and Wellness, and I oversee the departments for independent living and the programming and care. So I wanted to just mention what can be one of the more difficult parts of my job are handling transitions out of independent living. Because let's face it, nobody wants to leave their apartment or cottage and move across the bridge. So actually, once people get over there, they realize how nice the care is, and they do even better because they're getting that help. But it can be a difficult transition. Just wanted to mention, so Susan Thornton in my office, she helps with transitions as well. And I just wanted to say, we are your advocate. We're here to guide you in your aging needs as you age in place. We work along with you, your family, and your caregivers. We coordinate with our interdisciplinary team on your behalf, and that's nursing, social work, therapy, the clinic. The vice president of healthcare sits on that, the director of nurses. So we have a big team that discusses your care and progress. And then, of course, we transfer you to a higher level of care. When we look at needing a transfer to a higher level of living, we are seeing an overall decline in functioning independently. We may be receiving more reported concerns from staff, residents, and family. Ambulation can be getting difficult. Getting to and from meals is a struggle, and that's a big one. Difficulty with medication management for some. You're needing more medical attention from the clinic. You're needing increased attention from staff for your daily needs. You may be asking your neighbors for help and not telling us. Some people may be self-isolating, and you could be spending more time in the hospital, assisted living, and healthcare. If you choose to try and remain in independent living longer, some residents will choose to hire an assistant. And we do have a private duty policy, and it states that Westminster Canterbury requires all private duty sitters used for assisting a resident with activities of daily living to be employed through a licensed agency. And this does not include helpers who provide domestic type services such as laundry and cleaning. Activities of daily living include dressing, bathing, toileting, any hands-on care. And then just a note, residents in independent living may retain private duty employees for up to 8 hours a day if necessary. So anything above that 8-hour mark, you really need to make a move to assisted living or healthcare, whatever it may be. We just don't have the care here in independent living to support that. The following two slides come from your contract, and everyone has a different contract, although the following two slides are consistent throughout your contract, no matter which one you have. And you can come by my office if you want a copy of your contract. So, independent living criteria under 5A in your contract, you must be physically and mentally appropriate to reside in independent living. And I'll just read a portion of that. As a condition of occupancy of the residence, you will be physically and mentally capable of performing routine activities of daily living and able to respond appropriately to emergency situations. So that is something we do look at. And you went through that process already. When you became a member of our community, you went through that screening and you were deemed appropriate to live in independent living. And then under H, transfer from residence. Not everybody knows that this is in there because maybe you didn't read over everything, but you do agree. You have agreed that if you need a transfer to another level of care, that you give our team the right to place you. But we do include you and your caregivers in this decision. And I'll just read another portion of that. Transfer from resident states the resident agrees that Westminster Canterbury will have the authority to determine whether the resident should be transferred from the residence to assisted living, memory support, or health care, or from one level of care to another level of care within the community. But again, we work with you and your family, and typically we all get on the same page. It may take a while and a lot of conversations, but we get there together. And just wanted to mention your transition begins in the Resident Life office. We work with you and your loved ones, and everyone does have a unique situation. We make a plan to tailor to your needs. And a couple things I wanted to mention. I don't want to sell your apartment. I get told that. I like to say marketing wants your apartment, but they have nothing to do with this decision. So I wanted to add that. But before I get the other speakers up here, are there any questions about what we just talked about? Yes, ma'am.
I came in a minute late, but you said that the medical director helps make the decision. Who, please, is our medical director?
The question is, who is our medical director? Our medical director is Dr. Lord.
Oh, okay.
Yep, yep. Yes. So the question is, does Dr. Lord have access to records if he's not your physician? So Dr. Lord does not oversee your care if you're not his physician, but as part of our medical team, yes, he would see those records. He could get that based on your permission. Yes, ma'am. Yeah. The question is, do our contracts get covered later, whether you're fee-for-service or life care? And yes, they do. Melinda Turpin will be presenting on that later on. Yes, sir. Yes, sir. So the question is, does the resident family sit on these meetings that discuss your care and a possible transition? Yes, sir. The family or caregivers, whoever you have in your life, as well as you, sit in on these meetings. Anything else for me? All right. Andrea is here to present on our clinic services.
Good morning. Well, like she said, my name's Andrea. I'm the clinic nurse. So if you come to the clinic for any services, you're going to see my face. Lori Sweeney is the director, or she's actually the vice president of health services, so she oversees all the activities that go on in the clinic. Like she said, Dr. Lord is our medical director for here on campus. He's been here for almost 14 years now. So Dr. Lord is mainly on campus on Thursdays only. He's usually here all day, but he does see patients that follow him here from 8:30 to 9:30 on those Thursdays when he's here. We are excited to announce that we do have a nurse practitioner that will be starting in the next couple weeks. So that will open back up some availability for urgent care visits. If you are a patient of Dr. Lord's, once she gets set up and established, we'll get her schedules back up and running. But in the meantime, if you needed to see someone, you would just contact me, and then I would reach out to Dr. Lord, and we'd figure out what we need to do from there. If you develop an urgent problem or medical emergency anytime, day, night, weekends, you can call the front desk, you can push your pendant, and there is a nurse available 24/7 to you for assistance, and that is whether you are a patient of Dr. Lord's or not, you have nursing available to you 24/7. So if you have any questions, just call the front desk or push your pendant, and there will be a nurse available to you. Again, I'm the nurse in the clinic, and then 2 days a week we do have a CNA that comes in and helps out when we have providers in the office. Her name is Tanya, and you will see her smiling face on Wednesdays and Thursdays most of the time. So we do have lab services that are available. We have a lab tech that comes from Dr. Lord's, from the CVFP office. She comes every day, Monday through Friday. She's usually here from about 8:15 to 9. If you are a patient of internal medicine on Landover, we can do your blood work here. We just need your orders. If you see another CVFP provider, unfortunately for billing purposes from their office, we can't do that blood work here anymore. If it's a provider for Centra or an outside provider, then we can do those services, but we just have to have lab orders in order to get the blood. We do blood pressure checks. No appointments are needed. Just walk in, have a seat, and we'll check your blood pressures for you. We do dressing changes if needed. We can assist with eye drops, especially if you're having cataract surgery. That's a lot of eye drops multiple times a day. We're happy to help. We can assist you with making appointments. If you're having trouble getting in touch with a provider's office, we can usually try to call and see if we can figure out what's going on. And then Monday through Friday, 8 to 4:30, if you push your pendant, you're going to see my face show up, along with security and maybe a couple other people if it's necessary. But I do run all calls to IL Monday through Friday, 8 to 4:30. We also have a dentist that comes to the campus. He is here every Wednesday from 9 until 4. If you are interested in seeing Dr. Massey on campus, just let me know. We'll get your records and get you scheduled. He does routine cleanings. He does fillings, root canals, extractions. He can do crowns, impressions, dentures, partials, you name it, he can do it. If it's something he can't do, he will send you to an oral surgeon. We'll get that set up for you. But like I said, he is here every Wednesday from 9 to 4. And if you have an emergency and can't get into your dentist and you really, really need to be seen, just call me. We can try to work you in. Usually we have some extra spaces available, and if it's something, you want to try Dr. Massey just to get in sooner, just give me a call. We're happy to work you in. He's happy to see anybody. Dr. Overfelt is here every other Thursday from 1 to 4 for podiatry. I'm sure most of y'all have probably heard Dr. Overfelt is actually retiring. His last day here on campus will actually be November the 14th. So if you are a patient of Dr. Overfelt's or ever been a patient of Dr. Overfelt's and you would like to come wish him farewell, please do so on the 14th. He will be greatly appreciated. And he will be truly missed. Dr. Overfelt has actually been here, if I remember correctly, they said he's been here for 35 years doing podiatry services. So he will be greatly missed. I do know that there are discussions about another podiatry practice coming in to pick up those services, but they're still working out some details. So hopefully for Confab next week, we can have some good news on that. Otherwise, if you have emergency needs and need to be seen by podiatry, contact me, and I'll see what we can do to get you worked in and make that happen, okay? We have an audiology technician that comes once a month. She comes usually the second Monday of every month at 1 o'clock. It is a walk-in service only, and a lot of the times it's mainly just to check your ears, if you're having issues with your hearing aids. If you get your hearing aids from Blue Ridge and you need batteries or something, you can usually call. If it's close to her coming, just tell her, say, hey, can you bring them with you? And she'll bring them with her. And that way you don't have to go all the way to the office. But she is here once a month, and like I said, it is walk-in. They cannot do any kind of hearing test here. We don't have a room set up for that. But if you're having problems, you can come speak with her, and she can go back and get you scheduled at the office. Just so you know, they do have walk-in clinics in their office. They are available Mondays and Wednesdays from 8:30 to 12:30, and then Tuesdays and Thursdays from 12:30 to 4:30. If you're having issues with your hearing aids in between times, you can just walk into their office for that. Any questions? Yes, ma'am.
How's the billing handled, or if you see Dr. Overfeld, or, whatever case
All right, so the question is, how is the billing handled if you see like Dr. Overfeld or Dr. Massey? So for Dr. Massey, we do paper billing if you have dental insurance. So usually what will happen is you will see a charge on your next month's statement for any services Dr. Massey billed to you. If you have dental insurance, please make sure you see me before you leave because there are forms I will need your signatures on. We submit those to your insurance, and then whatever your insurance covers, they will reimburse you the difference in a check to you made personally to you. Dr. Overfeld's office handles all the billing, so we provide them with all the insurance information. They bill your insurance, and if there's any copays or anything left, they will bill you directly. So any of the billing gets done by his office. Any other questions? Yes, ma'am. Okay. So the question is, are there charges for clinic fee services? So there are some clinic services that are billable. If you call and a nurse has to come visit you in your apartment, or you have a fall and a nurse has to respond, there is a charge for that. It depends on the level of nursing that responds. It's either $25 or $30 depending on if an LPN responds or an RN responds, and then sometimes that is billed on 15 minutes at a time. So if they're there for a long period of time, you may get like every 15 minutes that'll be a charge for the nurse. And that is in your, it is on the resident website, and it is in all the billing things that Melinda puts out every year. She updates that, and we've updated some of our prices and stuff. So that is in your fees schedule on what services can be billed. Some of it is not in there, and that's just because it's not things that we do on a routine basis. If we do an ear flush, there is a fee for that. The lab fees we don't charge here, but the office that's drawing the blood may charge for that, but that would be handled by their office. The eye drops, depending on how often, like cataract drops, those are usually 4 times a day. And it's based on how many weeks we have to do those. Sometimes you have drops that are 2 weeks, you have some that are a month. So it's based off of how long we're administering the drops 4 times a day. But it's usually like $10 or $15 for every 2 weeks. Don't quote me on that. That's a long list of charges that I look at. But those charges get put in at the end of the month. We keep a log of everything that goes on in the clinic and everything. So every month those services get put in through me. If you have any questions, please feel free to come. If you see a charge on your thing and you want to know what it was for, just come see me in the clinic. Because if you've got a charge for nursing or any kind of medical fees, I'm the one that usually puts those in. So if you have questions, please feel free to come see me because I can explain to you what the charge was for. No, ma'am. Mm-mm. Is there a fee? Is there a difference if you're a life care or fee for service? No. For clinic services, the fee is based off of the service we provide. Whether you're fee for service or life care, it doesn't matter. The fee is charged for the clinic services. Any other questions? No? All right, well, I'm going to introduce Sherry Nash, who's from Home Health, and she'll come talk to you next.
Hello. Yeah, as Andrea said, my name is Sherry Nash, and I'm the administrator for Westminster at Home, Home Health and Hospice. And today we're going to talk about home health. So home health is a Medicare certified program, and it's covered by Medicare 100%. No copays, no deductibles. You must be considered homebound for home health to come to you, but it doesn't mean you just have to be homebound. You can get your hair done, you can go to church, see the doctor, things like that, but it has to be a taxing effort for you to go out. So if you're going out to dinner every other day, that's probably not homebound. It has to be ordered by a physician. You have to have had a face-to-face with your doctor for that and require the skills of a licensed professional. And those professionals we have are skilled nursing, and we come in to do wound care or medication management. Physical therapy speaks for itself most of the time. Everybody wants to walk, improve your mobility, strength, balance. In occupational therapy, a lot of people don't know what that does. We're not helping you get a new job. We are helping you with your jobs for life. So getting dressed, if that becomes difficult, taking a shower. If you can't get your socks on anymore, there are actually tricks for every single thing out there that you have trouble with. There are adaptations, and you may just not know about it. So it's definitely worth it if you're struggling, if you're finding that you're finished with your shower and you're exhausted. There are things we can do to make life better. So let us help you. Speech therapy doesn't just do speech. They do swallowing and cognitive memory impairments, things like that. And then we have home health aides. Home health aides are not private duty aides. They have to help with bathing and dressing for it to be covered by Medicare. So they can do a few extra things while they're in their home, but they're not going to be the people who are cleaning your house, grocery shopping, things like that. That would be private duty, and we no longer offer that service here. We used to have it, but before COVID, it got very difficult to staff, so we no longer offer that program. Let's see. Well, this is just a bunch of our staff. Myself, you'll see Jasmine's our social worker. We have our home health nurses are Wanda and Sarah. They would be the ones who come out to your home. And Craig is not actually on this list. He's our full-time physical therapist. Does anybody have any questions? Nope. Yes, sir. Yes, they would. If you have a wound that needs taken care of and we have a doctor's order for it, yes, they can come in as much as is needed. Normally not daily visits, but up to 3 times a week. And for a short period, we have done daily visits. But, yeah. Anyone else? Yes, ma'am? 100%. In independent living apartments, correct. So Javier is going to come after me to talk about outpatient that we offer here. But if it's too difficult for you to get to outpatient, for us, maybe you've had an illness, pneumonia, or a surgery, so you may get some home health therapy before being ready for outpatient. We do go in a 50-mile radius around the community, but really we began to serve our patients here and residents here at Westminster. We can be everywhere but skilled nursing. We can go to assisted living and independent living. Yes, Medicare covers it 100%. Yes, ma'am? Oh, thought I saw a hand over there. Okay. Anybody else? No? Okay. All right. We'll hear from Hav.
There they are. Good morning. My name is Javier Acosta. I'm the administrator for physical therapy here at Westminster Canterbury. I cover the outpatient as well as skilled. We're going to be talking about outpatient today. So that's our physical therapy family there. We've actually added to those numbers. There's about 15 of us now. So outpatient has 3 full-time physical therapists, 1 full-time occupational therapist, and 1 full-time speech therapist. At the present time, I actually have 1 physical therapist who is certified in Parkinson's. I have a speech therapist who's certified in Parkinson's, and my occupational therapist is going to be certified in Parkinson's probably within the week. So we're pretty much covered for all those kind of things. Now, what is the difference between our outpatient and Rehab Associates or Pivot or CORE? Are those places good? Of course they are. I have a lot of friends that work in those places. But in 2019, Westminster Canterbury decided to do something a little different. We decided to put our patients first. And let me explain what I mean by that. If you go to our competitors, you're going to be taken care of. But there's one therapist for 4 to 5 patients in 1 hour. We do one-on-one care here. That means you come in and you'll see either Jackson or Colton or Chloe or Caroline or Angeline, and you'll be with that one therapist for that 1 hour. They're not bouncing from patient to patient to patient. Now, do you succeed in that kind of therapy? Of course you do. As a matter of fact, the stats are showing that most people get better on their own about 25 to 35% of the time without therapy intervention. So the question is, are you getting better on your own because you're seeing with 5 other people, or is it the therapist really making the difference? I'm probably going on the argument that you're getting better on your own because that's exactly what you're doing. So if you want to exercise by yourself, it's better to go to the Y. You'll get better care there. We decided to do that because the statistics are showing that people get better with one-on-one care. So say, for instance, Lisa were to come to me as a patient, and I'm treating her neck. So she comes back because her neck is bothering. Eventually, it's going to start affecting her arms, her shoulders. If I'm seeing 3 people at a time, I can't pay attention to that kind of detail. It's impossible. I'm bouncing from one person to another. The great thing about one-on-one care is that I'm able to address things as they come up, because there's going to be chains of commands that are going to happen with therapy. So I'm able to address the different areas that tie into initially to the neck, and the turnaround and the turnout of the patient is much better. Also with one-on-one care, the patient gets better educated. So the patient's able to take the information that we're teaching them in the clinic, and they're able to take it home. If the patient's able to sustain it and maintain it on their own, the likelihood of them healing faster is greater. The other physical therapy places are, like I said, they're good. The therapists are really good. They're doctors of physical therapy. But they've gone after the amount of money that they're trying to achieve, and they're putting patient care second. We don't do that here. And so that'll continue going on. When we started in 2019, we started with 5 patients. As of yesterday, we're at 89 patients on caseload. And it's all one-on-one care. So we're doing really, really well. We take 52 types of insurance. We take care of all the authorization for you. So what does that mean? So we get a prescription from the doctor, and we will look at the insurance of what you have. We will run the numbers. We will call you. Hold on just one more second. Can you hear me? Did you guys hear anything beforehand? I'm sorry. Do you want me to start all over again? We take 52 types of insurance. We take care of all the authorization for you. So what that means is once we get the RX from you, we run the numbers, and then we call you to let you know if there's a copay, so there's no surprises. If you decide that you're out of network and you want to do private pay, the evaluation for physical therapy and speech and occupational therapy is $175. The sessions are $100 a session for PT and OT, and $150 a session for speech. Now you're saying, gosh, that's a lot. Not really. Our competitors are charging anywhere from $275 to $300 a session. So we keep our prices down so people can come and see us. Our hours are actually from 7 o'clock in the morning, and our last patients are taken at 4 and 5. We're here on the weekends only during holidays to make up for any treatments that we're missing, but we're here Monday through Fridays. Is there any questions at all on physical therapy for outpatient? Well, thank you so much for coming. I appreciate it. Lisa?
I have a little fun fact. So 16 years ago, I worked as the social worker for our rehab nursing unit, and Sherry Nash, who just spoke, was the director of therapy. So we started together in those roles and moved around a little bit here. But thank you for coming today. These are some tools you can use to remain in independent living longer, and we support that very much. Next week, we will be hearing from our rehab unit, from our skilled nursing, and that whole team. So you'll have some different speakers and the people that oversee those departments. Are there any other questions about today? All right. Thank you for coming.